All right,
Thank
I'm going
you.
to let everyone in.
Of justice.
Okay.
Can you hear me?
Yes, Vivek, we can hear you.
I got you, Vic.
So, Rovina, we muted everybody, right?
Yeah, that's what I'm trying to do. I'm trying to mute everyone.
Hearing some music.
I'm hearing some music too.
Okay, better turn that off.
I think that's what it was.
Okay, so maybe I can begin because we don't have a lot of time. Welcome, everyone. This is Uday Kapoor, and I am a NAMI Santa Clara County board member, and my focus is supportive housing. It is our privilege to welcome two distinguished community leaders to this town hall about mental health issues. Santa Clara County Supervisor Dave Cortese and Ann Ravel. Ann will actually join us about 7:30, and we will begin with Dave. So I want to talk about Dave. Dave Cortese grew up in East San Jose as part of a family that has been active in civic, cultural, business, and charitable activities for generations. Dave was first elected to the Santa Clara County Board of Supervisors in 2008 and re-elected in 2012 and 2018. He served 4 years as board president. Prior to joining the board, he served for 8 years on the San Jose City Council, including 2 years as vice mayor. Also for 8 years, Dave was a trustee for the East Side Union High School District. So welcome, Dave. What we'd like to do now is ask you to give your statement or your views on some of the questions, some of the issues that we care about. And so that'll be 10 minutes. After that, I will hand over to Rovina Nimbalkar, our executive director, who will ask some questions that we have received from the community. And we'll also look at chat questions that can be asked as we go along. Okay?
Yes, wonderful.
So that, Dave, please.
All right, thank you very much today, and everyone who's participating today, and everyone involved with NAMI. Thank you so much for all the great and profound work that you do. My background was mentioned. I served for 8 years on the city council after 8 years on the school board. I had to pack up my private sector desk at the age of 45 years old and move to the old city hall in San Jose, which was my first full-time, occupation as an elected official, if you want to call it that, really a vocation. And I do think being a good public servant as an elected official is sort of like a ministry. There's only one reason to do it, and that's to help people. It's not a financial a way to make money. I did that, and I certainly know what that's all about, but that's not something you do as an elected official, of course. And, you're always reminded during campaign season, it's not something you do for fame or popularity, because at any given time, perhaps up to half of the people are not happy or at least critical, and they have a right to be critical. People have a right to be critical. There's a lot of things going on that need to be dealt with. But I just want to give you that part of my background so I could kind of give you some insight into the idea that going over to the Board of Supervisors 11 and a half years ago, I was elected during that first big turnout Obama election, just to put it in perspective, right? That was 2008. It really became a huge opportunity for me to work on issues that I felt really connected to, not so much land use like I was at the city, whether or not a Jack in the Box should be built on the corner, but issues involving, real human need, real human pain, real human consequence. And that's always been where my heart is. When I first joined the Board of Supervisors, my very first budget, now keep in mind I was sworn in December of 2008. And by January of 2009, I had to start looking at the budget. And it was one of those recession kind of years, as you recall, a very deep one. And all youth mental health services were on the chopping block. Vic might remember that, and some of the rest of you might. It's a past story now, a war story, as they say, but all mental health services at the county for folks under the age of 18 were being proposed to be cut in that budget. And, I learned the system pretty quickly and learned that you could put a budget memo in or a budget legislative item in and try to add things back into the budget. And any supervisor can do that out of the 5. That's one of the great joys of being a supervisor is hardly anyone can stop you from bringing something forward and putting it on the agenda. And I've been, had the opportunity to work with some of you exactly like that on legislation and other issues. And fortunately, we won the day and that money was restored, or at least most of it, so that we never went a year or a day without at least baseline, mental health services that were consistent with, to some degree, consistent with the prior year in the county. And that really became an eye-opener for me in my early years on the Board of Supervisors as to how important the relationship was between budget and investment in services, but also because I heard from advocates, because I heard from people impacted or potentially impacted. I was asked at that time to go tour facilities that in one case, a young woman walked me up the facility, and I don't know if it was a ploy or not, but there was a sign on the door, sorry, if you had an appointment, we're closed and you'll have to come back, another time. Sort of heartbreaking to see that. And, the cascading effect of what happens to somebody, it's enough to have, mental health and behavioral health issues that are significant. And then to make the commitment to be at your appointment, only to get there and find out, that there's the rude awakening of services not being available, I think is enough to destabilize most people, in that situation. So fast forward, I have made a big issue out of permanent supportive housing. As you know, I co-chaired the 2016 Measure A campaign, which I think many of you were involved with supporting. That gave us, for the first time in this county, and really for the first time in the state of California, a county had $700 million for extremely low income housing. That's just not a category that had ever really been funded before. Very low income, little bit of funding, most from HUD. Low income, certainly we were getting some of that from developers at 20% below market. But extremely low income, it had been unheard of despite battles for it over the years. So I'm proud of the fact that we passed Measure A. I'm proud of the fact that the wraparound services that are provided with those extremely low income units are dealing with mental health and behavioral health issues appropriately. Another opportunity that came along when I was president of the board the first time, I served as president 4 times over the first 9 years that I was on the board. The first time was the year Jerry Brown said, we are going to we are going to send parolees back to the counties for supervision. And of course, a lot of the parolees that were coming out of state prison had mental health, behavioral health issues. And we created a program out of what became AB 109, a reentry program here that turned recidivism on its head. Instead of 70% reoffenders, we have over 60% non-recidivism through that program. And it's because of the diversion, the intervention, the assistance. I've gone over, many of you know that that work is actually done next to the old San Jose City Hall near 70 West Heading in San Pedro, in a little old city health building there. There have been many times I've gone over there and just sat down with permission of the clients in group settings to participate myself, in group discussion sessions, group therapy sessions, because I believe that's necessary. And I know I've talked to Vic and others about this, but I think without some lived experience around mental health and behavioral health, it's hard for me to fathom how an elected official could really carry forward the kind of agenda that's needed to turn this system away from a criminal platform, and onto a fully medical health platform. All of you know, it's well documented. I was just on a webinar with the Medical Association talking about the high percentage of officer-involved shootings that are mental health suspects, if you want to call it that. I would call them clients. I would actually call them people in need of help, in need of medical assistance. Those numbers range from 20 to 25% based on jurisdiction. That's extraordinary and extraordinarily bad. And if you have a loved one and they're having an episode of some kind, and a family doesn't know what else to do, they do what they've been taught to do since they were in kindergarten: call 911. And who shows up is not EMTs typically, or not yet mobile crisis intervention, because we haven't perfected that yet, unfortunately, but officers with badges and guns. And that is not the right response. It is something that's been going on, obviously, for hundreds, if not thousands of years. And it's something that needs to be corrected. So I wanted to give you a taste for, my posture around mental health, behavioral health issues, my belief in how important lived experience is in moving policy, in understanding policy, in having the kind of deep feelings about the issue that are really required to generate the passion to get things done in Sacramento or even in Santa Clara County. So I'll stop there. I have a sense that I'm at almost exactly at 10 minutes. So
Yeah, that's right. That's perfect.
thank you.
Thank you. Thank you so much for that. We do have some questions, so I'm going to go over them, and I'm going to ask you one by one. The first one being, are there any plans to create housing units that offer small single bedrooms and offers communal dining with on-site management and supervision and medication disbursement? Example, more like Riviera Villa, which is in San Jose, a good solution for those with mental health issues.
Yeah, facilities like that actually can be co-financed or subsidized by the Measure A program that I was talking about right now. I mean, the Measure A program is trying to provide studio apartments, small apartments for folks at the extremely low income level, which can easily, qualify many with mental health issues who are disabled at the level of, it could be high functioning, but still disabled in the sense that they can't work. Their anxiety is so great, or some other issues that cause them essentially medically or health-wise not to be able to function well enough to bring in the kind of income somebody else would to pay for that kind of an apartment. So yes, the common area dining and those kind of things are just amenities. They don't affect the qualification for that kind of financing. So for those that aren't familiar with that program, that $700 million is matched 3 or 4 to 1 with nonprofit housing developers, municipalities, sometimes private developers, to get the most out of the dollar. We match it or stretch it like that. And then we require that these kind of facilities that you just asked about are built in. Even in a moderate income apartment complex, we will allow as a county, you know, for example, 2 floors that are for extremely low income that would house folks that need wraparound services in common areas like you're talking about.
Thank you.
We can use more in the state of California. Remember, we're one of the few counties that has a bucket of money like that right now.
That's great. Yeah, thank you. Thank you for answering that question. The next one is, are mental health resources being expanded due to the need with COVID?
Yes, they are, but you know, the whole response to COVID has been almost triage. As you know, we've put, I think we're closing in on $200 million of general fund money into COVID relief, and there are so many issues that, you know, it's almost as if the county is spread too thin to deal with them all. But I'm not suggesting that they aren't being dealt with. I would like to see more done. For example, the Valley Homeless Healthcare Plan has mobile units now that are going out to encampments that are addressing, for the first time, really, you know, the 33% of that population that has chronic mental health issues, and getting them into motels with wraparound services. 800 have been housed that way already. They're screened. Of course, there's professionals that can do that in those mobile units. But, you know, I'm complaining because there's 35 or 40 encampments and there's 1 or 2 mobile units that are rotating around. I think they need to be much more saturation level than that, especially when we have the double or triple risk of, you know, exposure from the elements, exposure that would be caused by folks who are not functioning well due to a mental health problem, and then COVID on top of that. You know, that's high risk, really high risk. So we need to do more. You know, and that's just one example, but I think the county overall, and probably every county in the state of California, needs to just dramatically increase the number of beds that are available, even for short-term occupancy. I'm not talking about permanent institutionalization or anything like that. I'm just talking about getting people somewhere in a step-down type atmosphere where they can be stabilized if they're willing to do it. And I mean, statistically, 50% or so may not, or may not stick around with that kind of a program, but 50% or so do. And it's those that aren't getting the opportunity. I'm sorry if I'm preaching to the choir, you know, all this stuff.
Yeah, that's fine. That's good. Is there any action on enforcing parity in mental health treatment, especially in substance abuse disorder, and getting access to therapy for mental illness?
Yeah, it's, you know, I support the same kind of efforts Senator Bell has been supporting for complete parity. He endorsed me in the Senate race, as you might be aware. We've talked about these issues a lot. Somehow, Jim Bell and I ended up on a similar, parallel, but very similar path in life vocationally, not just in terms of where we serve, you know, city, county, state, and I hope I get to serve at the state, transportation agency. You know, we've had a lot of similar experiences as elected officials, but also if you look at the issues that we focused on, mental health, the developmentally disabled, you know, other issues that we have in common. He's, again, without getting into the details of any lived experience, there's nothing that will cause a family 2 steps back any quicker than you know, the joy of finding a step down facility that will, you know, accept your loved one, a child or someone like that, only to have somebody come out and say, well, you know, you're not covered. And, you know, some of us have the capability of working around that, or we just will somehow, some way. But so much of our population doesn't and won't, especially in these times ahead, which are going to be difficult economically. So all the more reason we need parity as we go through this deep recession after the pandemic.
That's good. Thank you. What specific public policy actions would you undertake to facilitate easy access to mental health care and supportive housing?
Investment. I mean, we need investment. You know, right now, there's probably somebody at the county EPS that's waiting for a bed to open up. You know, in a county of 2 million people, how many placements are there possible at any given moment? 1, 2, maybe in the county, you know, and then people end up having to be placed in Fremont or somewhere else. I mean, we just need to invest. That's why I suggested a couple of weeks ago that, as you may notice, they're demolishing the jail. They call it Main Jail South, the old jail, behind near our building on 70 West Heading. And he said, you know, it's not too late for us to shift that plan. And instead of building a new jail, let's build a new state-of-the-art mental health facility, a combination of facilities on each floor that allow someone to transition sort of vertically up and down with the kind of care they need. Let's just make that investment. Of course, we did vote to make a youth facility finally over at VMC, and you would think that might have happened 20 years ago. That's so critical because youth coming in with an issue, I think oftentimes it's hard to diagnose and discriminate as it is, because especially if they haven't had any pre-diagnosis, and then you aren't sure whether it's a medical problem or, you know, a mental health problem per se, you know, especially, or a behavioral health problem with some sort of addiction that's going on that triggered one thing or another, or it's just a problem in and of itself. That's all the reason you need to have a facility that's embedded right within your county hospital, your healthcare facility. So what I'm trying to say is, when you say what needs to happen or what is happening, a lot more needs to happen, but those are a good start, and we just need to accelerate that kind of work in this county and throughout the state.
Yeah. What practical solutions can we provide for teenagers who are lonely with anxiety in the current COVID environment, learning from home?
You know, that is a challenge. It is a real challenge. And my kids, I raised 4 children. I have one back at home right now from UC Santa Cruz because of the situation now.
Yeah.
And I have a daughter in her 20s that had to come all the way back from New York because she'd been there for 3 years, but she's a restaurant worker. So pretty hard to live, to make a living if that's what you do back there right now. And, you know, I can see firsthand still, even with children of that age, the impact of having essentially been disrupted in terms of all their expectations of what school was going to be like, their routines, or what they thought their routines were, what we often would call study habits. You know, before this, I think we had epidemic levels of suicidal ideation. I was with the Reverend Jesse Jackson in Independence High School back when I was a school board member, and he asked 5,000 kids in the gymnasium how many knew someone who had suicidal ideation. Almost everyone raised their hand. And then he asked the question, which I almost thought was inappropriate. He said, how many of you yourselves have had that? And there was a very huge number of young people who raised their hands at that point. How then is that compounded by, you know, the isolation, the overdependence on the screen, the lack of social interaction, which has already been minimized by technology. It's a huge problem. Over the last 3 years, 275 deaths by firearm in Santa Clara County. This is just basically since Measure A passed, according to my statistics. 275 deaths, according to the medical examiner coroner's office of Santa Clara County, were from firearms, just were firearms related. 179 of those were self-inflicted. You know, and so I do think, I'm going to say something that might be a little touchy for some, and I hope I don't overstay my welcome when I say this, but I think there's a little debate out there about whether we're stigmatizing, by talking about the propensity to do the wrong thing with a firearm if you're struggling with mental health issues. It's not about stigmatizing a young person or an adult. It's about just looking at the facts. We have an issue here if 179 lives could have been saved. Those are pandemic level numbers. They are. And I just think we need to break through the barriers and not fear talking about that. Certainly we should need to be in the right environment to talk about that. I don't want to talk to President Trump about that personally, because I think he has a different point of view than I do on it. But I think here in this county where people are appropriate and empathetic, we need to have that conversation.
Thank you. How can parity become a reality? We are so far away from parity.
Just political will. In going to Sacramento, I'm 64 years old. I'll say, just to be completely fair, my opponent and I have both extensive experience, but I'm not going to speak for her, but I'll say for myself, I'm not going there to cast passive caucus votes or to make people happy so that I could be lieutenant governor someday or something like that. This is a dream I have, to go there, to be trusted by the people, to rattle the cages a little bit, to go up there and say, I'm not afraid of the consequences on any of these issues. And to fight for parity like Jim Bell has done would be a real, and to win, I think would just be a crowning achievement for his legacy. And when I say people have trusted me with my vocational career here in public service, he's trusting me now. He's saying, I'm endorsing you. I'm trying to help you get there. And I think I owe it to him and everyone else, including my own extended family, and all the folks who were underserved in my district, the East Side area where I grew up. I owe it to them, not the caucus, but I owe it to them to fight for parity. And I'm not afraid of the consequences of doing that.
When elected as a state senator, what is one mental health policy, especially impacting youth and marginalized communities, you would champion, and why?
Well, parity. I think I'm going to say something that's a little more broad-based, but you'll understand what it is. We've made tremendous progress, and I've been a champion of early diversion away from the justice system, pre-booking, to make sure that we're using every resource we have to essentially put juvenile hall out of business. And make no mistake, when you have 49% of your jail population as clinically diagnosed with mental health issues, you're basically using your jail, 50% of your jail as a mental health facility. The pipeline for that is our juvenile system. And it's something I made a commitment to when I was first elected to the school board in 1992, that I was going to do whatever I could to mitigate the problems, to lessen the problems, to turn around the issues around high-risk youth. And part of high-risk youth is a huge piece of it, as we all know, are behavioral health issues around addiction, addictive behavior. And when those are combined with any kind of diagnosable mental health issue besides I consider addiction a mental health issue standalone and a medical issue. You combine that with some other diagnosable mental health issues, and it's a recipe for somebody ended up incarcerated. And we can figure that out. We can figure out from the schoolyard where the fight started, not to head to juvenile hall, but to head to intervention directly. Skip the booking, make sure that kid doesn't end up on probation with a rap sheet, and let's start figuring this out right now. And I hope that wasn't too broad of an answer, but that's the kind of thing I want to work on as well as a state senator.
I think Anne is here, so I'm going to give it out to Uday now.
Okay, thank you. Welcome, Anne.
Thank you.
So what we'll do now is thank you, Dave, for your questions and answers.
Yeah, thank you
Uh,
very much.
And I understand I'm supposed to, if you don't mind, I'm supposed to stay in case there are
Yes.
chat
Yes,
questions.
please, feel free
of
to stay.
course.
Yes, please.
Thank you.
So welcome, Anne, and I want to say a few words, give a short bio. And
Thank
Anne
you.
Ravel has served at the highest levels of the government, developing creative solutions to the needs of the public, and has served as the County Counsel in Santa Clara County and was honored for groundbreaking work and programs for consumers. She was appointed as chair of the Fair Political Practices Commission by Governor Brown and Deputy Assistant Attorney General and chair of the Federal Election Commission by former President Barack Obama. With that, welcome. And what we'd like to do is have you make a 10-minute statement. And after that, Rovina Nimbalkar, who is our executive director, she will ask some questions.
Thank you.
And I also encourage people in the audience to send questions through the chat. And if we have time, we will continue to ask questions, both from Dave and from Anne. Thank you.
Thank you so much, Uday, and thank you everyone for being here. I really appreciate the opportunity to talk to you. This is an issue that is really near and dear to my heart, that I care a lot about. And I know you can ask questions about this, and that you might be asking some about personal experience with it. But during this COVID period, I have my oldest granddaughter, who is absolutely the apple of my eye, who just turned 10 this week, was having a severe mental health issue, and it was discovered. She was 9 years old. My son went into her room and saw her toys all lined up like a funeral pyre, and she told him that she wanted to die. And that was not the first experience in my life with issues like this, but it really came home to me about COVID and about what's happening. And obviously, mental health is a huge issue. It is a huge issue, even greater now. It has been all along, but even more so now, given people's PTSD and depression and the lack of connectivity with others. And so I'm a strong supporter, and I'm very happy to be here. And I know you had a number of issues that you wanted me to address. Obviously, what's really important is early access for everybody, for all members of the community, to mental health care, as well as supportive housing. And they're critical now. It is even more critical than ever. And I do believe that families with children have to have ready access to behavioral mental health as part of their entire healthcare solution. And of course, in what we know is stable housing also has to be really important, and preferably low-cost owner-occupied housing, rental assistance, and longer stay housing options, rather, so people can feel like it's really home and like they're a part of the community. And you asked also about the safety of the mental health community during COVID. And obviously for in-person visits, there has to be PPE provided to mental health professionals. But I also know that a lot of mental health professionals, because of what they're doing, and the same is true for other health professionals as well, they too are experiencing the need for counseling. And that has to be readily available to mental health professionals so that they can continue to deliver the services that we need so much at the highest standards. And I know that there's also bills pending about telehealth, and I think telehealth can be useful, and I would certainly support those bills, which would help not only for care that's, I guess it's integrative with both, primary care physicians and others, and that could be really helpful to provide medical care and more so mental health and behavioral health care to children and pregnant women and others. You also asked about suicide prevention, and clearly for suicide prevention, what is really necessary all along and early is preventative mental health treatment. And that is the most effective way, I think, to treat suicide. But at the same time, when the situation warrants it, there needs to be more crisis counseling and certainly crisis hotlines that have to be well funded and available to everyone who's in need, no matter what their economic background is. There has to be total accessibility to mental health care. And I know there too, there's also legislation that I would support. It's on the governor's desk for signature about an Office of Suicide Prevention, which I think is a really good idea to do. You also asked about peer support and Jim Bell's measure, the Jim Bell's bill, and peer support. And I know that that's something that you work with it here, but that's really helpful, I think, because it's good to have people who have had these experiences and understand what people are going through. And that makes a lot of sense. And training them and getting them involved in the health system is a really good solution to the dearth of mental health professionals that we really need as well. I mean, no question about it, but it helps people be understanding about dealing with people who are going through their own mental health challenges. And all of these things, I think, we need to be able to access funds and federal funds, and the state needs to sort of play a really strong part in providing all of these kinds of services as well. And of course, we know that a lot of this comes through Medi-Cal and sometimes governed through Medicaid, and certainly that, in my view, needs to be expanded. The Medicaid in the state needs to be expanded. There needs to be expansion of the ACA. And with regard to mental health parity, which is significant problem in that there isn't parity of mental health treatment with insurers and with others. And I support Wiener's bill to be able to provide greater parity. And it is something that I would definitely push to make sure. And that too is on the governor's desk. And if the governor doesn't sign it, it's something that I would bring up again, because having parity with mental health is really important, that insurance carriers should not, or others should not, be able to deny coverage for something that is so intertwined with people's well-being that it is clearly an aspect of overall health that needs to be addressed. And so people shouldn't feel worried that they can't get coverage and then they will have worse issues. So that's first and foremost. But also, I mean, it just is the right thing to do to make sure that everyone can have equal access and really good access to mental health treatment. I mean, I just think that it's almost shocking that that has not been part of the law up to now, or still now, but hopefully it will change, and that is something that I would strongly push as well. So I think I dealt with all the major issues that you had, and although I think you also asked about mentally ill in prisons, and frankly, I think that the mentally ill shouldn't be in prison, period. We know there's lots of them in the Santa Clara County Jail. It's ridiculous. Many of them are homeless, and also young people. Certainly, those are not the places. You don't get your mental health care that is appropriate in a prison setting, and it's not appropriate for people who are mentally ill. And so, you know, I think that entire system of going back and forth to jails, but also the problem with, you know, the criminal justice system, where it's okay, if they're not able to stand trial, well, then they're mentally ill, so they'll go and sit in jail forever. I just think that that's inhumane, and that we cannot have an incarceration system that is, you know, full of people with mental health problems. We should have alternate mechanisms to have those people get treatment. And some of the things that they're put in jail for anyway right now, and the ones who particularly homeless who are on the streets, it's certain acting out. It's the wrong place. It's the wrong place for them to be, and they really need treatment. And frankly, and you didn't ask that question, but it's related in my mind, and that is the police treatment of the mentally ill, and police always responding to those issues when people call and have problems, and therefore they don't know who to turn to. Well, we absolutely have to have a much different system where there are people who understand treatment, understand perhaps some of the peer people going with the police, but if there needs to be a whole group, a team that goes and to interact with the mentally ill, and not to look at it as a law enforcement issue. I tell you, I don't know how many of you might have seen that video of that was going around in New Mexico of the young man who was in his grandmother's house, mentally ill, acting out, but nothing violent. And he was killed in his home, asking his grandmother for water. I mean, I think that is so inhumane, and it can't persist. It's something that we need to change, most definitely. I don't know how my time is going. Are you?
No, that's fine. I think we can probably now start with some questions.
Okay.
Thank you, Anne, for
Thank
the
you.
information. So the first question is, what specific public policy actions would you undertake to facilitate easy access to mental health care and supportive housing?
Mm-hmm. Well, I think with regard to supportive housing, most definitely, this is a really high priority for me. And what I have really disliked about a lot of the housing bills that have been proposed is that they did not deal with this segment of the community. They really weren't for very low income or low income people. And what we need is more housing for that group, so that there is supportive housing, in particular for those who are homeless, where there will be drug treatment, mental health treatment on site, as well as job training, so that people have an opportunity to re-enter society and be part of the community. and feel a sense of, self-worth. And having them on the streets is not the solution. And so I really believe there's a lot of ways that we can do funding and not just make the people of the county pay more taxes, but ways to find funding at the state level, and also to use, for example, excess land that the state now requires public entities to give lists of it. Lists aren't enough. We have to require them to provide it so that we can find places that are not going to be so expensive, and you could build housing, potentially modular kinds of housing that can be built more quickly, because frankly, I think this is urgent. I mean, when we talk about the housing crisis is not about people who, work for the tech industry and can afford $1 million homes. The housing crisis is about low-income housing, and that's the crisis, and we've got to do it now.
Thank you. My next question is there any action on enforcing parity in mental health treatment, specifically in substance abuse disorder and getting access to therapy for mental illness?
Right. Well, I think that there is the Wiener bill where they're looking at ensuring parity for all those things. And certainly, I don't know whether it covers also substance abuse, but that is something that I would insist, because they're obviously correlated. And that should be parity. There's no question that all of those things should be covered, whether it be by insurance carriers or any of the other programs where people are getting health care now. And frankly, I mean, even that isn't accessible enough, and there needs to be more ability for everybody to access it for low cost or free.
Thank you. How can we increase the availability of supportive housing and help many individuals that will be left unhoused due to aging parents, COVID-related mental illness, released from incarceration due to COVID?
Right. Well, this is kind of similar to what we were talking about before, but I think what we need to do is have a faster timeline. We cannot, because we know that there's going to be more people in this situation because of COVID. We know that, and so I mean, obviously there are places where there could be more temporary housing. Personally, I don't like temporary housing, because I think that we need to treat the mentally ill and people with drug issues like other human beings, and not warehouse them in any way. On the other hand, that may have to be a temporary solution. But it should, no matter what, nonetheless, those kinds of places that are being, now built, but we're also, we can build more. There is no question we should, because we know that we don't have enough housing now. And even the housing that was, being built under Measure A, it's slow. And what we need to figure out, and I know there's been for the governor has provided money for refurbishing motels and the like locally, but that's not always suitable for people like that, because it does not have any of the help for mental illness and counseling and drug counseling. It doesn't provide them. So they're not the best situations for the people that you're talking about. Mm-hmm. And I would call this one of the first priorities that needs to be funded in our state, because all that money that has gone for homeless, like in San Francisco, tons of money has been spent and it hasn't even put a dent. And it isn't just because there are more homeless, which there are, but it hasn't been utilized in the most creative ways. And that's something that we need to think about.
Thank you. What practical solutions can we provide for teenagers who are lonely with anxiety disorder in the current COVID environment, learning from home?
Mm-hmm. Well, I think it's really important. We know that teenagers need to have some connection with friends. They absolutely do. That's important for their mental health. And I think, and I've talked to Mariko Sayoc about this at length, and because she's doing the programs with kids in the schools, and she, for one thing, all schools need to have mental health counseling. There's that should be a mandate, that there have to be people, whether there be social workers or mental health professionals that are working in the schools, and particularly also during COVID, even when it's being done on Zoom. But there should be ways that the schools also help the students to interact with other students, whether it be in Zoom or what other way is possible, but just so that they have that personal connection to their friends and don't feel so isolated.
Thank you. What is your plan to expand the mental health care in Santa Clara County if you are elected?
Mm-hmm. Well, the things that I have been talking about are things that I would definitely do in the county. And I think some of the problems also, we know that money comes from the state, then it goes through the county, then it goes to nonprofits, and it takes a long time to get to the people who need it. It takes a long time to make sure that those programs are in effect and people get the mental health care that they need. So I think we have to look at another system, and the state clearly has to fund that. And there need to be more beds. There are insufficient beds. Even the money that was spent, Prop 65 money for mental health care, has not really been utilized to its full extent. And it needs to be used, and there need to be all kinds of different levels of care that are provided to people. And that's what I would insist on as a state senator.
Thank you, and thank you for answering the questions, and thanks, Dave, as well. I do have some questions in the chat box that I'm going to ask both Dave and Anne. And let me begin with the first question here. What specific actions will you take to destigmatize mental illness?
Do you want, which one of us first?
Dave, did you want to go first?
Yeah, that's fine. I think some of what we talked about when it was my turn earlier to deal with the questions and the answers. I mean, the biggest issue of all in terms of destigmatizing mental illness is what we've all been talking about a lot this evening, is to get it off of a criminal platform. And I'm glad to see that happening to some degree through the intersectionality of the justice reform movement, of the BLM movement, of frankly, almost all the movements that are going on right now are pointing to the issue of, should a whole series of categories, if you will, of what should be safety net services that have been lumped into criminal response. That, to me, that's the ultimate stigma. And it sounds like actually that both of us tend to agree on that. I don't want to put words in Anne's mouth, but we have a major problem in this country, in the state, in our own county, with how we respond when somebody picks up the phone because somebody's in medical distress, and they call 911. It looked like there was somebody in the chat room talking about that. You know, the police, even the ones who are trained in crisis intervention, CIT training, it's about a 2-hour course, as I recall. It's not enough. It doesn't qualify them to deal with the issue. And mobile crisis intervention needs to be dramatically expanded. And there has to be some coordination so that those folks, of course, feel safe in the most volatile situations. But anyway, that's the huge transformation I think that needs to be made. And then the rest of it we can deal with in terms of subcategories of stigma.
Yeah, and you know, thank you, Dave, because that I do agree with that completely. And I've got some thoughts about that, but let me also say just about stigma in general, about the mentally ill. I think we need to have more public awareness. And I'll say I just wrote an article for the Los Gatos and Saratoga Living magazine about mental health because I was so concerned about it. And I think that when people realize the extent of what we're going through and how many people are experiencing mental health issues at all ends of the spectrum, and if people recognize that, and of course, you know, there's people now who never had mental health issues, but because of the fires and because of COVID and because of you know, all the things that we're experiencing, the isolation from others and the inability to have those personal connections, that is causing an enormous increase in mental health issues around the country. And around the world, actually. I mean, even the UN has spoken about this issue. And so I think that we need to first also make people recognize that this is not someone's fault. It's not that people, you know, are bad. It's like any other medical issue that happens to people. And so first off, that would be important in my view, because I do believe that there is still a stigma attached to it. And with regard to, you know, the issues of law enforcement, law enforcement is just not appropriate for mental health treatment. No matter how much training they get, their focus is something totally different. And they're not, I mean, I know they get some training, but it obviously is not sufficient. And so, as I said, I really do believe that we need to focus more on responses. I mean, obviously, if somebody's worried that someone's going to be violent, then you may want to have a member of law enforcement go along. But the main treatment, the main response, should not be the kind of response that law enforcement are, in some cases, unfortunately, trained to do. We want the response of someone who understands what someone's going through and doesn't apply force to change it, because that's not helpful, and that's what ends up in people being killed. We don't want that. We want these people to be able to get better if they can. So that's.
Thanks. Thank you, both of you. And talking about law enforcement and CIT program, the next question is, Jim Bell was working on more police officers getting training for mental health emergency in the CIT program. What has been happening in the area since last summer? The reason I'm asking this is that I have called the number 911 for a family member, and oddly enough, only once did a CIT officer show up during all the time. Can we get more training or something different to help with mental health emergencies?
Mm-hmm. Well, I would say that yes, more training, but I still firmly believe we need teams. I don't think training is going to make the difference. I always say to people, I did a lot of training in the jobs I've had of people about sexual harassment, and it didn't make one iota of difference. I'll say that. There were still plenty of cases of sexual harassment of people who had been trained. So training, in my opinion, is insufficient of particular groups of people. I think the kind of training you want is people who are really professionals, who really understand the issues, who live with it and care about it and have gone into the field because they're empathetic, not because they're there for police purposes. I mean, I just think it's a different mindset.
Yeah, if I can answer, and I think we both agree on that. And you know, over the course of the hour, we both talked about, you know, the insufficiency of just trying to train officers with CIT training. They should have it, of course, so they can recognize to some degree what they're seeing. And you know, in a perfect world, they would pivot over to some kind of intervention team, a mobile crisis team. But you know, something that is really not happening right now, and it's a problem in this city of San Jose that I live in. It's probably in all 15 cities in Santa Clara County that have their own law enforcement agencies in their own dispatch. If you call for a mental health problem, there's really two choices that people want you to make. It's either violent and it requires the police to respond, or it doesn't require intervention at all. It doesn't require intervention at all. We don't really actually have such a thing as mobile crisis intervention teams, in my opinion. The way they're actually set up right now is, you know, if you don't reach a certain threshold of risk, which is this person starving? Have they refused to eat for several days? Are they violent? No. Okay, well then call us when that happens. That's pathetic. You know, that's ridiculous. And you know, so I mean, if anybody who's done recovery work knows that you either have to have some voluntary stepping into recovery, or you've got to have intervention, real intervention, which typically means some sort of group intervention. And I really actually think that's where we need to go, and that's what we need to get to. Anyone who calls up and says, you know, Ann was talking about a family situation or whatever, hey, I've got a situation here that's clearly a mental health situation, I think that is a threshold right there. There shouldn't be any more questions about how violent or how not violent in terms of whether we come out or not. The house call needs to happen right then, period. That qualifies you. And I think that's where we have to get to as a state and really as a country, probably as a world.
Thank you so much, Dave, and thank you so much, Anne, for coming tonight. To end this, I would like to invite Vic Ojakian, who is our co-president of NAMI Santa Clara County. Over to you, Vic.
Wait, we just zoom right along through things. Maybe just as, I wasn't going to do this originally, but I'll make a few qualifying remarks. I saw, Tracy, your comment. Jim Bell's two bills, he had two bills, they both passed. So what it means is officers in post-training, not CIT training, but when they're in the academy, their number of hours of training on mental health increased. It doubled basically in terms of the hours. So that all of that's in place now. And his second bill required the instructors to have more education. This seat, for everybody's knowledge, is a very important seat. There are 80 senators in the state of California, but the fact of the matter is that if we went back in time, the people who have led in the state legislature mental health were recently, I'm talking about, were Daryl Steinberg, who got a number of pieces of legislation passed in addition to Prop 63. Before he left, him and Senator Bell had a meeting, and they set up a committee, the Senate Select Committee on Mental Health, to make sure that mental health was always an issue in the forefront in the state legislature. Jim, on his own initiative, created the Mental Health Caucus, which includes assembly members in it, so that both houses have people who've expressed an interest in mental health and suicide prevention have a forum in which to talk. So we give Jim a lot of accolades about a number of things that he's done, but if you looked at it holistically, he has been the leader in the state legislature on mental health. So whoever fills this seat is filling, at least in my opinion, an extremely important seat. I just wanted to quickly recognize that we have 4 board members that I've seen. There maybe is some more that slipped in while I didn't scan everything, but I wanted to recognize, besides Uday, Harold Brown. You can see him in the yellow shirt. Harold handles our finances. We've got Peter Newman. He's our secretary extraordinaire. And the K isn't for cereal. That's Karen DeLumi, who's one of our at-large board members. Nava Statman, one of our guiding lights, called me earlier today and said she couldn't make it because she's teaching a NAMI training class right now. No better reason not to be here than that. And I'd probably be remiss if I didn't recognize Sharon Roth, who's one of the guiding lights of our particular NAMI Santa Clara County chapter. The reason why we held this forum tonight is a board member and some other people said, well, who should we vote for? What candidate should we pick, or whatever? And the response to that was, we're a nonprofit, so we can't promote a particular candidate. So the solution to that was to hold a town hall meeting so that everybody could get to see who the candidates are. Now, my own personal opinion again, some people talk about voting for the lesser of 2 evils in an election. In our case, we get to vote, those people who are in this district get to choose between 2 very good candidates. And so having this town hall meeting, I think was invaluable. So it gives all of you a chance to think about what both Ann and Dave said tonight and make a decision. But as a district, I think the district's fortunate because of the quality of people that these 2 people are. Everybody knows what October 5th is?
NAMI voice.
That's when the absentee ballots go out. So you got a chance to get a ballot if you're taking an absentee, or I guess I should say the dreaded word all of a sudden, a mail-in ballot. If you can get your ballot by then if that's how you choose to vote. So gives you a chance to decide on what you do and get it in as early as you choose to. So since I'm going through calendar dates, I can't pass on this, Ravina. Does everybody know what October 10th is? October 10th is, see the smile on Ravina's face and Tracy's face? October 10th is our NAMI Walks Silicon Valley. For us, it's a significant event, not just because we raise funds from it, which some of us are out there, working like crazy to try and see that we do that. But it's also, we've always used that event as a way of letting the public know who we are. I've got a number of people, I've asked hundreds of people, and I've got a number of them to donate. It's been just as rewarding that a segment of them said, I'll be at the virtual walk. because we have to do it virtually this year because of what's going on. And then everybody knows November 3rd is election day. So that's when you, if you haven't gotten your mail-in ballot and you haven't turned it in yet, that's when you can vote for people. So on behalf of NAMI Santa Clara County, I want to thank Dave, both you and Ann, for being here tonight, sharing your thoughts. And I think it's unfortunate in a lot of ways that Jim has to leave, but I think his seat is going to be in good hands. So we're honored that the both of you could spend time here tonight, and thank you very much.
Thank you so much.
Thank you.
Thank you.
Thank you very much for coming, everyone.
Thank you.
You.